Good afternoon, everyone, and thank you for joining for this COVID-19 media update and briefing. We will be addressed by the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. Kenneth George, Infectious Disease Specialist and Head of Isolation Facilities, Dr. Corey Ford, the Senior Medical Officer of Health, Dr. Leslie Rollock, and the Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman. Minister Bostic will start first with a statement.
Thank you very much, Lisa. Good afternoon, everyone. A special welcome to our stakeholders in the media. I welcome everyone to this update, because this is what it is, an update in our latest battles against the protracted war that it is, the fight against COVID-19. I felt it necessary today to give you an update because there were several stories and opinions circulating in the media, social and otherwise, and it was important for us to be able to come to speak to you. And I know the press have been after me for sure for the last couple of days, but because of some international engagements I was unable to respond. And more importantly, however, is the fact that there are some technical details and some observations that the technical team would have made as a result of our analysis of the current situation, which I think is necessary for the team to share with you and to be able to respond to any questions that you have so that we can clarify everything. You would have recalled some time ago, I believe maybe January, February, I would have said to the country that we needed to endure a period of short-term pain in order for us to enjoy long-term gain. And I'm happy to say that because of the collaborative efforts of everyone, that we are indeed enjoying a period of long-term, well, I hope it is long-term gain, but that depends on each and every one of us. But what I'm seeing at the moment is a situation where I have to caution everyone that we must not enjoy short-term pleasure that will cause us long-term pain. And I'm saying that because there are some signs across the country that suggest to me, and also the cases we've had recently that suggest to me that we need to tighten up. We need to tighten up because we want what we are experiencing at this point in time to continue for as long as possible. And this is the situation that we face today. I know you would have seen over the last 3 days or so a slight increase in the number of cases on a daily basis as compared with the last several weeks. And the technical officials will be able to explain exactly what is happening. Let me say that I'm not worried about the slight increase in the numbers, because this is one of these situations where the statistics for me really are not the important thing at this point in time, but it is what we've been able to deduce or to analyze as a result of the positive cases that we have had recently. So that we are still in a good place, but we have to make sure that we remain in a good place. The Ministry of Health and Wellness and all of those persons who have been operating with us, we have not been able to achieve this alone. The government has not been able to achieve it alone. We've had to do so with the cooperation and the support of Barbadians in general. So we cannot maintain what we have and even improve on it if we do not have that support and that cooperation going forward. The fact that we have eased up on some of the restrictions is not an excuse for us to throw a caution to the wind. It is not an excuse for us not to observe the protocols. And I speak in this vein because I know very well, and for those of you who have been following the international news, you would recognize that countries that had been doing very, very well for a period of time have suddenly come under severe pressure because it only takes a couple cases to turn things around. And we have to ensure that in Barbados, we do not suffer that fate. And so that is why I'm urging everyone to continue to follow the protocols. We've been doing a number of things in the Ministry of Health and Wellness. We have been doing our work in terms of reacting and responding very quickly to the cases that we've been seeing recently, and those details will be explained to you. But this is what is going to keep us safe. And I remember saying to you that at the end of the day, the scientific method that is tried and tested more than anything else in the fight against COVID is the non-pharmaceutical interventions. That is the things that we were doing before we were able to do a lot of testing, before vaccines were here, before pharmaceuticals were available for the treatment of serious COVID cases. Those things, the very, very common things: hand sanitizing, wearing of masks, physical distancing, respiratory etiquette. These are the things that are going to save us and keep us on the right track. And so I will now hand over to the Chief Medical Officer to give you some more details. I'll be available to take any questions which you may have at the end. But today really and truly has to be about the technical aspects of COVID-19 and the work that is being done and what my team would like to see each and every Barbadian do going forward. Thank you very much.
Thank you very much, and good afternoon all. Good afternoon to the media. It's a pleasure to be here this afternoon, and I would like to update the country on what has happened in the last few days. Please recall that on the 22nd of June, we came to the public and indicated that there were 7 cases. This was 6 females and 1 male. And at the time, we were going through a period where we were having either 0 cases or not more than 2 cases per day for an extended period of time. Effective on the 22nd of June 2021 and up to our last reporting period, we have had a total of 29 cases. And this is a cause of concern to the Ministry of Health. Fortunately, those cases have been identified in 2 family clusters and a manufacturing business which was already spoken about in the media a few days ago. So I repeat that we have 2 large family clusters plus a manufacturing establishment. And out of that, those 3 areas, there was some school involvement. So you might have heard in the press the Princess Margaret School and the Ann Hill School. We continue to do the appropriate contact tracing. We have been on this path before. The contact tracing at the moment is very advanced. And therefore, we have several persons in hotel quarantine managing that situation. Those persons are usually put in hotel quarantine so that the individual cases will not end up spreading disease to either other family members or colleagues and friends. We have invested quite a bit in hotel quarantine for these individuals. These individuals are usually primary contacts and require 2 tests. We again ask the public for your cooperation because we have been this path before. And I tell you sincerely that we can get out of this situation, but we need your help. The other major area I would like to encourage the public to understand, it is critical that you come forward. Those persons who have not been vaccinated, identify yourselves and we will assist you to make sure that you can receive the vaccine. To date, we have been able to first vaccinate over 92,000 persons living in Barbados, and about 64,000 persons have had their second vaccine already. This is good, but we need to improve on this. And there are some special groups I would like to encourage to come forward to make sure that they are vaccinated. These are individuals who work in our healthcare facilities across Barbados, whether it be the geriatric hospitals, the psychiatric hospital, or the Queen Elizabeth Hospital. I sincerely encourage you to be vaccinated to protect not only yourselves, the staff around you, but in particular the clients that you service. It is important as we move forward to hear the message of vaccination. At this point in time, we are also looking to increase the lot of persons who are vaccinated in the younger age group, because we know that that population is still a vulnerable population. So in closing, I'm asking the public again to cooperate with us in the Ministry of Health. We have been on this path before. We are going to hold your hand. We have put some special measures in place, particularly as we open up the country a bit more. But I will encourage you all to go back to the basic principles, as Minister said. The issues of mask wearing in public is absolutely important. Thank you so much.
Thank you very much. Thank you very much, Dr. George. We now go to Dr. Ford.
Barbadians, it's a pleasure to spend this time to talk to you about what's been going on in the country in terms of isolation, the isolation facilities, and at the far end, I will take probably swing off my normal talk to really to encourage Barbados on a few important points. I think in updating you, I will just give you a good idea of what's going on within our facilities and be very genuine about what's going on. So let's talk about Harson's Point. So at Harson's Point, we know we have isolation facility there, and at present we have 3 persons in the general ICU, primary ICU area. That would be a total of 2 males and 1 female. Of that 3 persons that we have there, 2 of them are extremely ill, what we will classify as severely ill, and are intermittently on ventilator support. The other individual, another young female, is stable at this particular point, but we continue to watch her and continue to provide the care that she requires. Of those 2 individuals, which I mentioned, who are significantly ill, there are Barbadians as well as the other young individual. They're pretty young individuals, and this is really what I really want to talk to you about today. I know there's a lot of talk and there's a lot of ideas as to, if you're young, you don't get ill, but I will tell you that of these 3 individuals, 2 of them are young. They're in the 40 years age group. But to also say, just a few days before, we had another young male who was in the secondary isolation area, who's 20 years old, who actually presented quite ill. So for all of you Barbadians out there who think because you are young that you can't get ill, this is not true. We have seen this certainly in this over the last particular week. So I caution you with regards to that. In our secondary isolation area, like I said before, we have 1 non-national there. She's quite well. And we have a recovering male who is in that area, who is Barbadian, who was extremely ill at presentation, but who is doing quite well at this point. In the facility, we have 1 pregnant female. We have 6 children, 2 males, and 4 females between the ages of 2 to 15 years of age. And I'm just going to say something to you, to every Barbadian who's listening to me today, and I'm probably going to go off script a bit. But there's something that says, Alice not Sibi, for others not herself. And that's something that some of you who went to particular school out there might know what that means. And I say that to say this. Look, what is important about that information that I just gave you? COVID has gone nowhere. And I want you to be first aware of that. And I think Barbados is, at this particular point, we are at a strategic crossroad, and we desperately need the help of the public to help us in this particular respect. We need people from the heights, from the terraces, from the blocks, from the middle class, to the children, to the adults, for those in the rural and urban areas to help us to calm this particular situation. But additionally, I need not only Barbadians, but I need all the residents across this country and visitors who are on island to work with us. And with regards to what? I think we must have a high index of suspicion. And in having a high index of suspicion, what does that mean? Simple, down to earth. If you have a cough, a cold, a fever, if you have shortness of breath, if you think your sinus has gone off, if you have a headache, if you have diarrhea like some of the patients presented with, I'm asking you, I'm pleading with you as we try to figure out and get things together back into this country where we were a few weeks ago. I'm pleading and begging with you to go and get tested. This is one of the things that came out of these admissions that we have seen, and I've gone off script, but I'm going to stay in line. But I think this is important. I think a lot of people who've presented to us, out of the 20-something people the CMO have said, had symptoms and were at home and were still moving around. Some sought medical attention, but very few did. And this is worrisome. And I think that in that group, there were a lot of young people. And I would say that the average, you would not believe, the average age group of admission in our first outbreak was about, you're talking about 80s, 70s, 60s. In this particular part that we've seen, we're having many young people between the ages, I think our average age is somewhere between 25 and 27, and that is worrisome. And they are all had symptoms, which gives us an opportunity to collect. I think if these persons presented to the healthcare system or went to their doctors, things probably would have been different. So I think that's important. So getting tested is important. And for you young people out there, I'm a young fella, just like you. I work at a facility with many young people. And there are lots of young people who are working at the facility in the fight against COVID. They've given up their time. They potentially have even practiced to give it their lives in the fight against COVID. So I'm just being very real with you this evening and asking all the young people out there in the terraces, on the blocks, right, on the street, in the schools, etc. I am begging you this evening, right, as we're at this juncture. We have done extremely well. I don't think there are many countries across the globe with the support of the government and the Ministry of Health who have seen a large rise in cases across your country. And in a matter of months, we get it down to 10, 5, that sort of numbers, no cases, right? And we have done that with your help. And I am calling upon the general public this evening to heed this particular call. If you have symptoms of any nature and you're not sure, if you live in a household and somebody has a cold or cough, encourage them to go get tested. This is how we're going to figure out how, where we're going to be going in Barbados and the sort of extent to which we are at this particular point. So this is a serious encouragement to you. And of course, the last part is really the elephant in the room. And I know one of the major problems as an infectious disease doctor and having, communication with many people across the globe, that there are lots of challenges with regards to vaccinations, and people are scared. They're worried and they're worried. And I'll tell you, being one of the first people in the country to be vaccinated, that yes, there is that anxiety about vaccinations. But I'm still standing here. I don't think I'm walking on my head or talking on my head today, to be frankly honest. But I think the important thing is that we know from the evidence that is out there so far that there is a serious benefit to being vaccinated. And I can use some of the evidence certainly out of our own local environment. We have people in the facility who have brought their children, for example, who would have ended up with COVID, for example, and they have not gotten COVID. These are some of the small things. If I had a little bit more time to do this, I would talk to you more about that. But I'm really encouraging, especially young people, when you hear there's an opening to get vaccinated, I am pleading with you this evening. For the sake of all your other people at the facilities who are giving their life and time, to try to prevent, the sort of catastrophe that we had in Barbados, certainly dating back to January and March. I'm asking you to come forward and certainly be vaccinated at this particular point. And ultimately, I think we all need to be proud of in Barbados. None of us wants another lockdown. And I during the conversations, I was looking over the social media and to see what people were saying. And this is my final statement to you. We as Barbadians, we need to be proud of what we have accomplished, certainly dating back from January to present. There are not many countries who have done that. We need to be proud of that. But to remain in that position, it depends on all of us in country. Every single Barbadian, from the school child to the parent in the household who's seeing their kid doing something, to you who let your child go to Sheraton and run around, without a mask, to you guys who catch the bus and don't wear the mask or have the bus packed, we can't go back to that. If you want to stay out of lockdown, I am pleading with you. There's nobody in this country who doesn't want another lockdown more than me. I want to get back to normalcy, right? But I'm asking you genuinely this evening to please follow the protocols. Go and get vaccinated. I want to see those polyclinics or wherever they're giving out the vaccine, once you've done what you're supposed to do and register. I want to see many of you lined up to go and get vaccinated so that we can get back to normalcy in this country. You want to fet, you want to party, you want to do all of these things, right? You want to keep going to church as normal, right? These are the things we have to do. And I just want to, as we go through this little bump, I just want to thank God for all of the help and certainly and for all of those who've been praying for us on the ground. I want to thank all of you this evening. That's all I have to say. Thank you.
Thank you very much, Dr. Ford. We'll now hear from the Senior Medical Officer of Health, Dr. Leslie Rollock.
Good evening, Barbados, and thank you for this opportunity to tell you a little bit about the 2 clusters that we are currently managing. So we have the first one in a manufacturing establishment, I believe it's been called, yes. We have there 12 persons associated with that establishment. And we believe that this illustrates what has been happening when persons get comfortable. They believe that at this workplace we are all in the same bubble, and unfortunately they're not. And when they leave, they may go home to their families and take it. But so far, we have 9 persons in the workplace and then 3 other persons associated with the workplace. And that is how it happens. So we believe that this illustrates that your bubble is your home or your car with your family, but not your workplace. In the workplace, all the protocols should be observed that we have been reiterating, probably ad nauseum, but repetition is good. The second cluster that we've been monitoring is a family, essentially is a family cluster, but that family cluster has had reaches into other places. So there's family members, 8 persons in total, or 8 so far, 8 positives, but those positives have impacted another manufacturing establishment where persons have had to be tested and quarantined. So they're working at maybe on you could say with a skeleton, but not skeleton is probably the wrong imagery, but you know what I mean. With fewer persons. Then there's been the schools, and just one positive, which sort of makes us have to investigate the others, put them in quarantine and test them and retest them to verify that they are also not infected. So that is one other manufacturing establishment, 2 schools, 2 of which you have heard about. And the difficulty with schools is that it involves children, and we know that children, even though they are reminded to stick to the protocols, and they may be in pods in the classroom, sometimes when they go to lunch or they go to the bathroom and they meet somebody there, they might not do everything that they're supposed to. So especially with schools, in the abundance of caution, we test the close contacts, but we quarantine the close contacts, but we also have to test everybody that may be exposed. And I think that's all I want to say about that right at present. What I will probably do is give an opportunity for my colleague to go through the protocols one more time. Thank you.
Yes, thank you very much, Dr. Rollock. And the head of the COVID-19 monitoring unit, as Dr. Rollock indicated, Mr. Ronald Chapman, will speak now to the importance of the protocols and generally what his unit has been encountering over the past few weeks.
Hi, good afternoon, Barbados. It is a pleasure for me to be here this evening to talk a little bit about the protocols and what we've been doing and what we've been seeing in the island. First off, I would like to piggyback or springboard off of what Dr. Ford had said, in that over the last few months we have recorded significant success in the country with reference to dealing with COVID cases. We've had spikes in cases, and in a number of months we were able to bring those cases down. Now, we have done so through the hard work of those in a number of different ministries, private companies, and indeed the entire Barbados, the individual Barbadians. But what we are seeing here is as the cases fall now, what we are seeing is a bit of complacency on the part of a number of persons. I put it this way, that we are quickly becoming a victim of our own success, because we believe that now there's just one or two cases out there, and those cases are far removed from us. And as we can see with the manufacturing facility, and we see in those families, that is not the case. Those cases are not far from us. Those cases are very close to us. So what we're seeing is some complacency with persons in in following protocols, the wearing of masks. The persons are feeling as though now we're comfortable. There's no COVID in the environment. And I just want to reiterate, COVID hasn't gone anywhere. I'm not sure if it's going anywhere anytime soon. It may go away in Barbados, but in the rest of the world it's still there, which means that at some point in time we may see a flare-up again. But that is not what we want. And that is why we are asking persons to follow the protocols. What we've also been seeing is, and we mentioned this before in terms of transmission in the workplace, what has happened is we have put a number of protocols in workplaces. And those protocols there has been more emphasis in terms of protecting clients from staff and staff from clients. So if you're going to the supermarket, you're going to any store anywhere, there is temperature checks, there's hand washing facility, hand washing or hand sanitization, there's physical distancing, and there are barriers, and there are all other measures put in place. However, when there are no clients and the staff are in the back, the staff treat each other as though they are part of each other's bubble. And this is where we are finding the transmission. This is where we are finding the lapsing in protocols. And this is where we are asking persons, please, please, do not drop your guard in your workplace. You have no idea what that person, what situation or environment that person you're with has been in the last 24 hours or so. So we're asking persons, please. And also in places of recreation, there has been some easing of protocols with respect to bars, with respect to sporting events and so on. And we're starting to see the same thing, persons lowering their guard because it would appear as that the message is, we are COVID free. That is why the protocols are easing. That is not the case. The protocols are easing because there are falling cases, and because, as the Prime Minister says, you give people a little ease. You don't want to be holding on too tight. Where there is opportunity for us to relax the protocols, to enjoy a time, but we do so responsibly, and it's that responsible part that we're starting to fall down upon. Now, I know that in the last couple weeks we've been talking about events for I wouldn't call it crop over, but it is there are some events that parties and so on that we are we are going to allow. Those parties would have a maximum of 150 patrons, and the actual logistics and so on of those parties have not yet totally been worked out. But what I want to say is, just we want to be able to treat this opportunity just like that, as an opportunity, and the ability to be able to show the world how you can provide an atmosphere of ease and recreation for a country without burdening it with COVID. We have been able to set the example with reference to our travel protocols. If you look in the what is going on across the world, almost every country right now travel protocols mirrors that of Barbados's protocols. The protocols we have put in place first. So what we are saying is we have an opportunity now to be able to show the world, not only in terms of travel protocols, in terms of dealing with cases, now how can we be able to allow the country to return to some semblance of normalcy and remain safe. So those are some of the things that we are working on, and we really we are looking forward to the Barbadian public. I want to say COVID is completely fluid. This is something new to all of us across the world. We've never been this way before. And because it's fluid, things change at the drop of a dime. So we cannot afford to take our guard down. Nobody wants another lockdown. Nobody wants to have curfews. Nobody wants to have restrictions. But if we don't want those things, then we need to follow protocols. And I just want to finish off by saying, I know that there are some persons, and this is for those persons who tend not to want to follow protocols. We haven't put a lot of stuff out there lately, but in the last week we had about 19 COVID-related matters before the law court. Of those 19 those COVID-related matters, we had 7 convictions, 8 adjournments, and 4 persons did not show for court. So the fines range between $500 to $2,000. So we just want to say it is easier to follow protocols and allow ourselves to enjoy the ease and the recreation and the normalcy of an entire country than to don't follow protocols and find yourselves running afoul of the law. I don't like to end my thing on like that, but I want to encourage persons to follow the protocols. We are in a good position right now, and we want to continue that trend. We want to get better and better as the time goes by, and to do that, we have to ensure that each one of us take responsibility for our own actions. And when we see others who are engaging in actions that are not consistent with what we know to be right, we just nudge them slightly and say, hey, you know what, just pull the mask up. Or maybe step back 6 feet if you're going to talk to me without a mask. So you want to be able to encourage others in good behavior, reinforce positive behaviors. We don't necessarily want to be constantly looking to punish bad behavior, but we want to do more encouraging of positive behaviors. So with that, I just want to say thank you very much, and I want to be able to enjoy some sort of event going forward. So please, let us all do what we know we're supposed to do. Thank you.
And thank you very much, Mr. Chapman. Well, as we open for questions, I will ask members of the media to introduce themselves and the media house they represent before posing their questions. Are there any questions?
Good afternoon. This is Barry Allen from The Nation. I have 2 questions for the Chief Medical Officer, Dr. George. Dr. George, good afternoon. Around January, the minister would have been at pains to explain to the country the differentiation between community spread and local transmission. And here now we have a number of clusters that the public health officials are investigating. Would you be in a position to say, with regard to these recent clusters, if there are examples of local transmission or community spread?
Can you hear me?
Can hear you now. Go ahead.
So thank you so much for that. We have indicated in January of this year that we had community spread in Barbados. And although the levels have come down significantly, we never told the public of Barbados that the community spread had stopped. We had always indicated to be on your guard. The best public health advice is to behave always as though there is community spread. And therefore, knowing that, you would be encouraging individuals to do the right thing. There were low levels of disease in our country, that is correct, for about 6 weeks. But this was going to happen if there were going to be transmission from person to person, if we indeed had let our guard down. So I hope that answers the question. We have situations of clusters, and there is spread from individual to individual, and that's the purpose of this press conference, to again seek from the Barbadian population that their ability to work with us so that we can prevent this from happening. Thank you.
So just for clarification, Dr. George, these recent clusters would be an example of continued local transmission then? Would that be a fair assessment?
That is correct.
Right, and the second question would be this. With regard to these particular clusters, the minister had mentioned just last week the identification of a number of variants of the COVID-19 virus in Barbados. Have any samples from these recent clusters been sent off for variant recognition?
So we continue to send samples both to Canada and to CARFA. And once we get back information on any new circulating variant, we make sure that the public of Barbados is told, and we give them that information very forthwith.
Good afternoon to you, Wendy Burke, CBC. As a follow-up to the variant question, at some point it was noted that we were going to be bringing some specialists in to assist with testing so we could actually detect variants here. Are we any closer to that, given the length of time it's taking between CARFA and Canada to get the results back of the variants that are actually present?
So Minister Bostic will speak.
Thank you very much. First of all, let me indicate to you that I would have mentioned a week or so ago that the Best Dos Santos Public Health Laboratory had the capacity to do screening for variants. It started first of all with the Alpha variant, and we would have received some primers from the Pan American Health Organization that would facilitate screening for the other variants. I also said back then that some of our equipment had to be sent overseas to be recalibrated to be able to allow this process to take place. And I'm happy to say to you now that yesterday evening that equipment was returned to Barbados and the Best Dos Santos Public Health Laboratory. And I'm advised that there's going to be some validation over this weekend to make sure that there was no changes in shipment that would to change or affect the recalibration. And once that is successful, then the lab would be in a position from early next week to be able to screen all positive cases for all of the variants. And this is an important and this is a significant step in the process. This would allow us to see exactly what we're dealing with. But we've also started to send more samples to CARFA, and the ministry is in collaboration and with the United Kingdom High Commission here in Barbados to be able to follow up on an offer that was made to us, and that is happening. And also the Public Health Laboratory again has been given the resources to be able to purchase the necessary equipment to take us to that next level where we can actually perform the genomic tests and sequencing here in Barbados, utilizing the persons we have here locally, as well as some Barbadians in the diaspora who are professionals and well qualified in this area who've been working with us. And this is ongoing And this part of it is ongoing. But the most important thing really is the fact that hopefully from next week, once all goes well this weekend, we are in a position to do the screening for all positive cases so that we can do the first screening for the variants.
Thank you. And my next question to you is in relation to the manufacturing plants and the contact tracing. Given that they are manufacturers, we would posit that they are doing wholesaling, et cetera, towards supermarkets, village shops, the like. Has there been a need at this stage to start contact tracing in terms of their clientele, their client base for their manufacturing?
Allow either Dr. George or Dr. Rollett to provide the answer for your question, because that is exactly what they've been working on.
Thank you for that question. At this point, the passage of the virus is not usually so much by fomites. On objects. The persons are not going to other places to carry the fruits of their manufacturing, so to speak. It is mostly person-to-person spread. So we are looking at persons that they have been in contact with, and most of those are their own workmates in the place where they work and their family members, and a few that they've been having social events with at this point. Thank you.
Good afternoon, Janelle Cornhill, Barbados Advocate. I have a two-part question in relation to the vaccines. I believe Dr. George and Dr. Ford were both encouraging Barbadians to get vaccinated. I'm first wondering, what has the response been from those who had their first dose in terms of going back for the second dose? And I think it was Dr. George too that mentioned that we want to vaccinate younger persons. I think up at this point in time, we're doing persons up to the age of 40. So I'm wondering if then you're going below the age of 40 and how soon?
Thank you so much for that question. Fortunately, Barbados is trying to source vaccines from multiple markets. You would have heard that Pfizer has been sanctioned to be used in persons as early as 12 years of age. And Barbados is seeking to make sure that we can have Pfizer here. We were happy to understand that the United States had made an offer, and we continue to, and this is through the Caribbean Public Health Agency, and we will continue to work with CARPHA to make sure that Barbados has vaccines in terms of Pfizer, which has been approved for persons 12 years and older. So as Corey has indicated, the age range of individuals presenting is a bit younger at this present point in time, because many of the individuals who were vaccinated in the first tranches were persons who were over the age of 70 and persons who had comorbidities. We had identified those two groups as primary groups who we were going to offer vaccinations to. And I think that as the vaccination campaign moves on, we would encourage younger individuals to get vaccinated once vaccines are available. You would recall that we got 2 sets of vaccines from the COVAX facility, each of 33,600 vaccines. We started off with 100,000 vaccines from a kind donation from the government of India. And we are pleased to announce that very, very soon we were hoping that the Sinopharm vaccine would have been here on Friday, but there was a delay, but that will be yet another option. So what we are trying to do in the Ministry of Health's perspective is to make sure that Barbadians have options for vaccinations, and there will be many other vaccines here in short order with respect to the choices that they will have. Thank you.
Dr. George, before you go,
But if you can answer the first part in
is
terms of,
Cuba included?
I'm sorry, Wendy. I'm sorry to
that you're including?
I'm sorry,
No.
Wendy. I believe that Janelle had a follow-up.
no, because you didn't answer the first part
The first part of your
in
question.
terms of if persons are doing, they're going back for their second shot.
So yes, we have had a good response. As I indicated, persons are coming back for the second shot. There has always been traditionally a small fall-off of persons in any immunization program with respect to the second dose. So we are encouraging persons to make sure that the only way you're considered fully vaccinated is to have 2 doses of the AstraZeneca separated by a period of 8 to 12 weeks. And after that, you're considered fully vaccinated.
Wendy?
2 weeks after that, you're considered fully vaccinated.
Lisa, I have 2 questions.
Sorry, Kerry. I believe Wendy was next.
Yes,
Okay.
Lisa, sorry for the interjection.
That's fine.
My question would be to, I guess, Ms. Colonel Bostic, because it's a policy issue. Is it likely that we may be considering the vaccine from Cuba?
The answer, Wendy, is that our policy is that as long as a vaccine has been given approval by the World Health Organization, that we would have that vaccine available on our list of vaccines for use in Barbados. So the answer is definitely yes, as long as it has the necessary approval.
Kerry?
News, I have 2 questions. The first question to Dr. George, with regards to the healthcare workers not necessarily coming forward to get vaccinated, I wanted to know about what percentage of healthcare workers are vaccinated and what's being done within the institutions to get these people to come forward outside of calling them out during press conference.
So it varies from place to place. It is as low as 35% in some cases to as high as about 60% in others. We believe that a good target is about 70% of all healthcare workers working at our institutions to be vaccinated, and we continue to work with them. What we are currently doing is an audit of all the healthcare facilities with respect to who is vaccinated, the type of staff that is vaccinated, because it may not only be nurses, it may be physicians, it may be auxiliary workers, etc. And we are carrying out an audit, but we will continue to work with individuals. There has always been an issue of vaccine hesitancy, and unfortunately, the hesitancy is not only part of society, but it is also part of the medical fraternity, the wider medical fraternity. So that is another reason why we believe that persons should have options for vaccinations, and we will try to continue to move along this path.
Okay, my last question. One question, Harry. I just got one more question. My other question is with regards to protocols and a plan for schools and businesses when positive cases occur, because right now during this press conference, at no point in time did anybody name the manufacturing industry, but you guys all waited for the media to break the news about the manufacturing industry. Everybody's referring to the manufacturing industry that was named in the media, but no one named it. And again, it's the same situation with the schools. Nobody came forward and said the schools. The media broke which schools it happened at. Teachers are very afraid. Some of the staff at the different institutions are afraid because there's no protocol or policy or plan. It's that when it happens, that they're going to be informed, or the communication is not forthcoming. Is there something that can be put in place? The union congratulated you guys on how it was handled at Princess Margaret in terms of the contact tracing. However, when you look at the Anhill situation / Irving Wilson, the ball was dropped there because they were just told to close the school and they weren't informed why. Parents then did not know why, and time is precious when it comes to COVID. Can anybody explain what's the protocol that's going to be put in place going forward?
Yeah, I'm going to take that myself because this is one that I responded to on a call-in program this week. And let me say to you, ma'am, that there's no requirement to put that which is already there in place. You refer to schools and you refer to businesses. It has never been the practice of the Ministry of Health and Wellness to name private sector institutions, businesses or organizations, or even individuals who are positive with COVID. We have done so in relation to schools and to government facilities. We came to you with the psychiatric hospital and we gave all the details. We named the psychiatric hospital. We named the geriatric hospital. We named the Queen Elizabeth Hospital. You would recall that we never named the elderly care facilities or their nurseries where there were positive cases, but we named the government schools, primary as well as secondary, but not the private schools. So this has been consistent throughout the entire period of this fight against COVID. In relation to the Ann Hill and the Princess Margaret School on this occasion, these are recent events. Recent events, and this is the first opportunity really to be able to speak to these events, because all of that information, recognizing that we were dealing with large numbers in relation to the possible exposures for these two clusters, the business and the schools. And also the Ministry of Health always communicate to the Ministry of Education if there is any positive at any school. And then if the situation warrants, maybe in a position where we have the details as to how many people have been impacted, in other words, considered to be primary primary contacts, and the testing of these persons, how many have been tested on first test. When we have that information, we always share that information. And I did last time with the unions. I had a meeting with the unions, the teachers' unions, and I went through all of the details with the unions. We are not in a position at this point to do so because all of the details are not available. But to say that we dropped the ball, and I don't mind if we really drop the ball to admit that, because I've said on this, I said at press conferences that anytime we drop the ball, we're going to dust ourselves off, pick ourselves up, and we can start again, because we are here to improve and to do things better as we go along. But there was no ball dropping. As soon as the information was received about a positive case, that information was communicated to the Ministry of Education. It would have been communicated to the schools, and the contact tracing process would have started and is well on the way. And I hope that in the very, very near future that we'll be able to come back and give you more details as to exactly how many people have been placed in quarantine. And we have over 100 and something people in quarantine in relation to some of these things you are talking about. So it is ongoing, but as soon as we have the details, we will share those details. There's no reason for us to hide anything. Thank you.
Barry?
Yes, thank you. Two questions. Dr. Ford, could you give us some indication as to what these young people who were found to be symptomatic when they were finally assessed, what was their reasoning for their non-presentation in spite of them being symptomatic? In other words, were they afraid of physical testing? Were they afraid of PCR testing? Were they afraid of being forced to be vaccinated eventually? What were the reasons for their non-presentation for assessment?
Barry, I find that to be a very interesting question, and I think it's one that's worth answering. I think when you think about the young people who have presented to the facility, and these are some of the questions that we asked to try to get an idea as to what's really going on in that population. And these individuals we actually found who were positive, who were all young, the majority of them except for one, actually presented to the healthcare system ill. And he was picked up at that particular level. And then that led to a follow-on of the cases which we found. But when you talk to many of them would say, yes, I had a loss of taste and smell. I had a cough. I had a headache. One guy had diarrhea, for example, which is significant. But they didn't present to the system. And the question is why? And why what they often would say is, well, I wasn't sure. There's one guy who actually said he thought he had it, but he wasn't sure. So, this is why I said when I spoke to the country minutes ago, if there's any uncertainty and you're not sure, go and get tested. His family know. And I think if you have a young person in your household who has symptoms of any sort, they have a cold, a cough, they think they had the flu, because most of them would say, I just thought it was the flu, doc. Right? And if you even think that, go and get tested. I think a responsible parent in the household will also encourage their child to get tested, because ultimately it can affect them. And the actual interesting thing about the question that you've asked is that from many of the individuals that we had, it led to their older persons in the household who may have not been vaccinated being affected as well. So I think it needs to be a very wide look at this. So I think if you have people in your household that you know as your mother, your father, your old little granny, who probably was vaccinated, probably would not get into trouble. But the others in the household who are not are potential problems. And this is why I think there needs to be to be frankly honest, needs to be a greater drive in encouraging our young people to come forward and be tested. And this is one of the things I would have spoken about this morning, certainly at the Emergency Operations Center, that I think there's this false perception among young people that COVID doesn't make you sick. And that's where the crux of the matter is if you talk to them, right? So they think, oh yeah, it's just a cough or cold. But when I tell you about the 20-year-old or the 40-year-old or the 35-year-old that are passing through ICU and that are sick, that we capture and treat and get better, right? And we stay up all night with, sometimes sleepless nights for many of the staff, then you might understand what I'm talking about. So again, I said it before, and again, this evening I am asking the young people, those on the block, if you have friends, go and get tested. If it's positive, we'll deal with it. We'll take care of you. But you have the potential to spread it throughout the community. You have the potential to spread it to unvaccinated people who might not be as lucky as you. And that's what you have to think. I said before, at least not Sibi, for others, not ourselves. And that's exactly how we need to think out there in the community at this particular point.
And my question for Dr. George. Dr. George, the minister would have just made reference to over 100 people being in some kind of quarantine or assessment stage. I wanted to find out from you if you have the numbers with regard to that assessment and quarantine. In other words, can you tell us how many people have had a first test? How many people have had a second consecutive negative test and been released that were in quarantine? What are the numbers regarding quarantine at these quarantine approved hotels right now?
So as Minister was right, there are in excess of 100 individuals. Most of them have had one test. Most of them have completed one test and are awaiting a second test to exit quarantine at the moment. They are located in, many of them are located, particularly the primary contacts, they are located at hotels across Barbados. The reason why we put them in hotels is to make sure that we are trying to contain the spread of disease.
Just one question for Dr. Ford. In the past, we would have known that at least 2 persons had retested positive for COVID. They would have had COVID like back in January, and then somebody, I think, had it in May, had gotten it again. This was a person who was working at the psychiatric hospital. How many persons have retested positive for COVID? And of the persons who have tested positive recently, how many were vaccinated?
Great question. I think from my memory, I believe there are about 2 other persons who would have tested positive for COVID after having COVID previously, but they had COVID a while ago. And I believe from my memory, if my memory serves me correct here, that both of these were non-nationals and those who entered the country. Additionally, I think the second question, I think I got it right, you asked about persons who are vaccinated who would have gotten COVID. Is that a question? Okay, great, perfect. So, right. So from my memory again, I only can recall 2 other cases of individuals who would have fallen into that particular parameter, but they were not ill at all. And it did not present with any significant symptoms to the facility. And I think that this, to my mind, is an extremely important point, and really the point I need to drive home. For all of you who are listening, to be specific, getting the vaccine, it will not stop you from getting COVID, but it will decrease your risk of getting COVID, one. But two, if you do, you're unlikely to get ill. And I think this is exactly why we're seeing the trends that we're seeing. And I recall you back to the first part of the outbreak and the second part of the outbreak and the age groups that we were seeing. We're not seeing those 70, 80-year-olds, 90-year-olds. It was a brilliant decision that was made, certainly, to try to get that population. That is the population that is difficult in terms of having comorbidities, in terms of the age group, in terms of providing medical care for successfully. But again, I have to stay on this particular point, is that because you are young does not mean that you can't get ill and gravely ill. And I say that in the context of the 3 persons this evening that we have at Vivian Harrison's Point in our primary isolation facility. They're all relatively young people. And it's important that 2 of them are extremely ill at this particular point.
Ford, a quick follow-up question. These young people that are down with COVID-19, though, do they have underlying conditions as well, or most of them are showing that they just have complications due to COVID itself? Sorry, Akeem.
Yeah, no problem. And that's exactly what I said. I think you may have missed it, Barry. You know, there's no comorbidities in these individuals. And that's exactly the point. This is exactly why I'm stressing on young people. I just want to see all young people like myself step out and register and go and get vaccinated, full stop. If you have symptoms, all young people like myself, if I stand up in a line with you and walk you to the facility, I would do that if I have to, right? Because we cannot, in this country, go back to another lockdown. And right now, just as the young people are fighting at Harrison's Point to try to keep stuff under control and keep people alive and keep people moving, I expect those in the community from which they come from and have given up their time to come to help, I expect them honestly to step forward and go and get tested. If you want to know where the sites are, when we're offline, I'm sure the Ministry of Health will provide that information where you could go and get tested. I expect, and I really encourage, honestly, young people out there, old people too, but young people, any symptoms, if you're unsure, if you have a headache, if you think you have sinuses, whatever, right? Go and get tested so we get a good feel of where we are in this country so we can proceed and progress, in short and simple.
Akio?
Hi, good evening. Akio Level, Starcom Network News. My question is directed to Dr. Corey Ford. As you said, we're always advised that being vaccinated minimizes the risk of being severely affected by COVID. Have there been people who were fully vaccinated that contracted COVID-19 and were in primary care at the isolation facility at any point?
I don't know if you go to church, but I'm going to tell you, no, not one. Right, and that and that is real. That's the realism of things, right? I'm a realist, right? And that's the realism of things. I have not had one person in my primary isolation or secondary isolation managed by the hard work of Dr. Lovell and Dr. Hassel in the primary isolation, right? I have not had one who's been vaccinated to this point, and that alone speaks volumes. I don't even know what more evidence I can give you to encourage those to be vaccinated. I really expect after this press conference, nobody can force you to be vaccinated, but I expect you after this press conference to use a bit of common sense. Use what I said before, at least now said, think about for others and not yourself. Think about your old granny who lives in the house with you, right? Think about your mother who lives in the house with you. You can come home from the block or hanging out or going to a restaurant. I started to think about the fact that you can make them ill. In fact, I don't want to get into specifics because it would be inappropriate. But I would tell you about a particular case of a person who's been vaccinated, one of those I mentioned, who was in the household, and their whole household was tested, and that person was strongly positive, right? And that whole household was tested, and no, not one was positive for COVID. That alone is an in-house answer to the question that you just asked.
Wendy?
Yes, I have 2 questions. One is firstly for Mr. Chapman and the second for the minister. Mr. Chapman, what I want to find out from you is in terms of the 150 number that we've reached for the events for those vaccinated. How did you all come up with that particular formula, firstly? And secondly, what steps have you already put in place to ensure that there's no falsifying of vaccination cards?
Okay, well, I'll start with the second one first. The verification of vaccinations and so on, that is something that the other members of the EOC will be looking at that come next week at our meetings, because as I said to the entertainers, these are the logistics and the smaller issues that have to be dealt with when we're looking at having the events and so on going forward. How are we going to verify the vaccinations? How are we going to get persons tested? What tests are we going to use? What are those sort of things, the nuts and bolts of it that still has to be worked out on the Ministry of Health's end. So that part of it is not yet completed. The 150 was given so not necessarily as an absolute number that will happen and will stay forever. The 150 was given so that we can start small. It allows a number of persons to gather with a manageable, what we think at this point in time is a manageable amount of risk for those at a party. As the Prime Minister said, as we go ahead and as we do it, we start small. As time goes by and we're sure we can get it done properly, then there may be room for us to modify that and maybe increase those numbers. But that 150 has to do with the ministry's ability also to conduct contact tracing. It speaks to the level of resources we have and the amount of risk we are looking to take at this point in time.
Thank you kindly. And my next question, as I said, Barry, which is for Minister Bostic. This is pertaining to the quarantine stays that we're having. Are you able at this point to give me, even if it's an estimate, what our hotel bill looks like for those persons in hotel stay for quarantining?
Answer you very quickly by telling you no, because I don't know. As Minister of Health and Wellness, I leave those matters to my permanent secretary, who's the finance officer for the Ministry of Health and Wellness. So I'm not really au fait with that. But I wanted to get back to your initial question to Mr. Chapman, because you would appreciate that I might know a little more than Mr. Chapman, and Mr. Chapman was on holiday. But I'm happy to say to you that the ministry does have an electronic vaccination certificate, which is now ready, and I believe it should have been rolled out today at the airport. But this is one that we've been working on and was approved by Cabinet. It carries a barcode and a security seal on it, and all persons who have been fully vaccinated in Barbados, who have been issued with a temporary certificate by email, they will get one of these electronic certificates with the barcode, and that is what has to be produced when they enter those establishments for those events that you spoke to earlier. And we will be speaking to the event organizers and so on over the next few days to explain exactly how this is going to work. This also allows Barbadians who travel to be able to take that with them for ease of travel when they arrive at their various destinations.
Kerry, I believe you had a question?
Yes, just one question. I know for Dr. Corey Ford, I know with regard to the cases that we are seeing, most are unvaccinated. So minors would fall under this because they don't qualify for the vaccine right now. Have we seen any more cases of misc amongst the younger population?
A good question. The answer is no to that at this particular point. Of course, that can change, but not at this particular point.
Right now, can you say how many minors you have in isolation, if any?
That information before. There are 6 children, there are 2 males and 4 females. ranging between the age of 2 and 15 years of age.
And a final question for Minister Ballstate. Minister Ballstate, earlier in your presentation, you had said we need to tighten up, but it was a pretty general comment. Can you tell the country where are the areas in Barbados where we've fallen down the most? Is it in the PSV sector with persons using public transport? Is it in cases of in public spaces where we are supposed to wear masks but are not wearing? Is it when Barbadians go out to restaurants and bars that they're not following protocols? Where are the areas that we are not doing as good as we should be?
The above. No, Barry, look, the concern ought not to be the names of business places or anything of that sort. We are falling down at the individual level. Why? Because each and every one of us, we have a responsibility. We have a public, a civic, a national responsibility. If we want to continue to enjoy the easing of restrictions, if we do not want to go back to a period of lockdown, which none of us want, then we have our own individual responsibilities. And I mentioned before, the wearing of masks, that has not changed. That is still a requirement in Barbados. And even for visitors who are fully vaccinated, who come from countries where mask wearing is no longer required. It is required in Barbados for the wearing in public spaces, and we've made that very clear. This is one of the areas where this obviously is falling off. And what I saw in the media in relation, for example, to the activity at Sheraton Center, the cinema, that obviously is not what we want. And that is not what the protocols say we should be doing. And so all I'm saying to you is that the very basic things, and Dr. Ford would have highlighted some of this, but the very basic things, Barry, irrespective of the vaccinations, the vaccines we may have, or the amount of people who are vaccinated, and we want those numbers to climb, yes, irrespective of whether or not variants are here, because variants are all over the world. The major thing is the simple public health interventions that we have insisted on from day one. This is what is going to save us. And if you were in an environment where there was a positive COVID case and you knew and you feel and know in your mind that you have been doing the things that you should have been doing, then you do not fear the fact that you may be positive. I don't. In all honesty, and even at that one time when I was in quarantine because the protocol says so and it was the right thing to do. But not once did I feel at all that I would have been positive. Why? Because I knew that I never dropped my guard during that encounter. And that is what we are asking of Barbadians and residents of Barbados to do. There are still too many people who, when you go to shops and other places and even see people on the streets in groups, students at bus stops, this is still going on where you're having large numbers of persons up under each other and people, most of them not wearing the mask. And this is exactly what I was referring to when I made those remarks, because it is the foundational things that will keep us afloat.
We have time for just one more question.
I have one question, Lisa. Minister, I know that the restrictions are to be lifted in a couple of days. I know that the decision is not yours, but we do have our cases going up. You said you're not particularly concerned right now with the increase, but are we still moving ahead with lifting those restrictions?
Yes, because yes, we have cases, but these cases do not impact on our indicators, the things that we always measure, positivity rates, the amount of cases per 100,000 of population and those sorts of things, and the kind of spread, and if there's more local transmission. For example, if you have one positive case at a school, but there are no more positive cases at the school, then you don't have an issue at the school. So what I'm saying is that our concern is because obviously a cluster will always be a concern. That's one. And secondly, if you if you see that because of a cluster that obviously there have been persons who might not have been obviously not following protocols, hence the cluster, then that is a concern. But the figures themselves really, they do not concern me as much as Minister of Health as the deductions that we've been able to make as a result of what we're seeing, which is that people have started to get complacent, and it is not over till it's over. It is still a war against COVID, even though we may win a battle. But winning one battle does not decide a war, the winning of a war, especially a war as prolonged as COVID is. And I will end finally by saying this because I think I need to say it is feeding the virus. When that virus comes around, if you want, let's get a bit graphic, and it comes up to somebody who they know the virus knows is fully vaccinated. No. The virus looking for people for vulnerable. The virus looking for people to feed on, to give it oxygen to be able to go through and penetrate the society. That is really what it is. So once you put up a strong defense to the virus, which is doing all the things, mask wearing and so on, and being vaccinated and being tested, these are the things that will put up the defense against the virus and stop the virus from spreading. And those are the words that I will end with this afternoon, and just ask Barbadians to do the right thing. Let us all do it together as we have been doing. We're in this together.
A very good point on which to end, Minister. As we close, let me thank the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. Kenneth George, Infectious Disease Specialist and Head of the Isolation Facilities, Dr. Corey Ford, Senior Medical Officer of Health, Dr. Leslie Rollock, the Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman, members of the media, and you for joining. Good evening.